Hi, thank you. Dr. Henry, I don't know, 18 cases of with the variant of concern isn't a huge sample size, but have you got any indication whether there's a younger cohort involved, if the symptoms are in any way more serious for younger people? Like, I'm just wondering if you know anything can talk about how this might change our path in terms of the pandemic in BC.
Yeah, I'm hoping it doesn't, but we do know that it is a younger group of people. We know that it is younger people that are traveling. So when I say younger, I mean people in their 30s, 40s. So between 19 and 50 for the most part. There is one younger person, a teenager, but these are people for the most part who have traveled internationally and come back. Except the 3 cases that we know of with the South African variant. So it is very much travel related. We're not seeing a lot of it in our community, despite the surveillance that we're doing around different outbreaks, etc., and the random sampling that we're doing on a routine basis. But it is a concern because every time this is introduced and it can spread, we can see in other countries how it has started to spread rapidly. And that is what we're worried about right now. It's hard to know what's going to happen in the next little while.
Follow up, Justine?
We've all given up on trying to guess at the future, I know, but you mentioned 3 different types of surveillance that you're doing. I'm wondering, what is the total amount of testing of this type that we're doing on a daily basis, and how urgent is it, do you feel, to increase that capacity for surveillance?
Yeah, so I mentioned we've done about 11,000, so it's the whole genome sequencing that allows us to pick up these specific different strains or variants of the virus, and the whole genome sequencing we can do about 500 to 600 a day, and we're trying to ramp that up to 700 to 1,000 a day if we can. As you know, we've had about 500 cases a day, so that doesn't allow us to do all of them, and the process is a little bit slower, so it takes several days to do the whole genome sequencing. So we have been doing, as I mentioned, 3 things. One of them is routine surveillance, so randomly samples, particularly in areas where we have higher caseloads. We've been doing specific outbreaks and areas where we're seeing rapid increase in cases, and we're doing all of the people who test positive after travel. So the priorities change a little bit depending on what's going on. Last week over the last 2 weeks, we were very concerned about the rapid spread in a couple of hospitals. So we made sure that some of the tests from those hospitals were checked to make sure that it wasn't a variant causing that rapid spread. The other one that we're watching very carefully is people who test positive after vaccination, and now that many people are 2 weeks at least past their first dose, making sure that we're not seeing any variants that would affect our immunization program. And so far we haven't, but those are targeted things too. So the BC CDC lab is coming up with a strategy. They're working as well with our counterparts across the country to come up with a national strategy for screening, to try and leverage all of the resources that we have, including the National Micro Laboratory in Winnipeg, laboratories in Quebec, Ontario, Alberta, to do whole genome sequencing as well.